Hi, this is Daniel DiTuro. Are you frustrated with the U.S. healthcare system? This is part 2 of my 5-part video series about the U.S. Wealthcare system. In this video, I share fee-for-service to practice medicine, the high cost of conservative healthcare, the NP or PA will see you now, and U.S. Wealthcare versus universal healthcare. Several viewers have expressed frustration with American doctors and their training. Most medical doctors are educated and trained to treat disease, often with prescription medicines, and not to prevent disease. While preventing disease is a noble goal, is it realistic? The 2019 coronavirus pandemic showed how easy it is to politicize disease. Wearing a mask and getting vaccinated infringes on Americans' freedom of choice. It is an American's right to be obese, have type 2 diabetes, high blood pressure, heart disease, and cancer. Government and doctors have no right telling Americans how to live their lives. Doctors know smoking increases the risk of lung disease and cancer. But doctors cannot demand a patient stop smoking or vaping. After all, smokers pay higher insurance premiums and need medical care more often than non-smokers. The same with drinking alcoholic beverages. For doctors to demand a patient stop smoking or drinking before developing serious chronic diseases infringes on their civil rights. As a result, many seriously ill patients make lifestyle changes after being diagnosed with a preventable chronic medical condition. To believe Americans will suddenly adopt a healthier lifestyle if doctors were trained to prevent disease is pure fantasy. Millions of Americans are literally eating themselves to death, and almost nothing is being done about it. The U.S.'s fee-for-service healthcare system guarantees decades of unlimited earnings potential. Fees for a primary care office visit can include x-rays, lab tests, vaccinations, injections, and electrocardiograms. A 30-minute primary care physician office visit can cost $1,000 or more. You may rejoice if the cost is covered by your health insurance. It's a different story if you are uninsured. Wall Street and investors love the unlimited profit potential of fee-for-service healthcare. But the high cost of fee-for-service healthcare means millions of Americans live with undiagnosed, treatable conditions that can develop into serious, life-threatening emergencies. Due to the increasing number of medical malpractice or negligent lawsuits, most healthcare providers practice conservative medicine. Conservative medicine means more tests, office visits, referrals to specialists, emergency room visits, hospital admissions, and more cost. The high probability of being sued for malpractice is one reason for the current shortage of doctors and nurses. Conservative medicine is a bonanza for corporate medicine's bottom line. More services means more fees, and more fees equals more revenue and profits. Conservative medicine is not better medicine, it's more expensive medicine. In the not-too-distant past, when you made an appointment with your doctor, you were seen by your doctor. In most cases, you could see your doctor the same day or the next day. Doctors were either licensed MDs or DOs. They had 10 to 14 years of medical school and residency training before being licensed to practice medicine. Doctors made house calls, and their home phone numbers was published in the telephone book. Today, house calls and calling your doctor at home are a thing of the past. Insurance companies force doctors into group practices by paying more for the same service. The high cost of a medical degree and dissatisfaction with corporate medicine has also contributed to a shortage of doctors. As a result, it can take weeks or months to be seen by your doctor. Or you can be seen the same or next day by a nurse practitioner or physician's assistant. Most NPs and PAs have a master's degree and are licensed to diagnose and treat illnesses and prescribe medication. Many urgent care and pharmacy clinics are staffed by nurse practitioners. While NPs and PAs earn significantly less than a licensed doctor, it's not reflected in your bill. If you're insured, the copay or deductible to see an NP or PA is the same as seeing your doctor. Why? For insurance companies, an office visit is an office visit, regardless who sees you. Your visit with an NP or PA is usually reviewed by your doctor. For investors and medical practice owners, the profit potential is enormous. A college graduate with a bachelor's degree can become a trained and licensed NP or PA in 1 to 2 years. Hiring 2 NPs or PAs can produce twice the revenue of a single doctor for about the same cost. A medical practice's profits increase, and instead of being seen by a doctor with 10 years of experience, you are more likely to be seen by an NP or PA with at least 1 year of experience. As I've shared, Americans love and defend free market wealth care until bills or problems start piling up. With micromanaged wealth care, there's no guarantee a doctor in network on January 1st will be in network on December 31st. If your doctor leaves your network, you must find another doctor or wait until the next open enrollment period to change your insurance plan. While many Americans believe the U.S. healthcare system is broken, millionaire wealthcare executives claim there's nothing wrong with the current system. After all, the United States is not alone in not providing universal health care. Countries with universal health care cover most expenses from cradle to grave. Before creating Medicare for Americans 65 and older and Medicaid for the poor in 1965, millions of Americans had no access to affordable health care. Medicare and Medicaid are government-run health insurance programs funded by a payroll tax. While many conservative senior Americans relying on Social Security oppose socialist universal health care, most have government-run Medicare, not private health insurance. If ads for Medicare Advantage plans are accurate, even multimillionaires love their Medicare plans. The irony is, the rich do not need Medicare or private health insurance since they can use petty cash to pay for medical expenses. The first real threat to wealth care was the 2012 Affordable Care Act. The wealth care industry's opposition to the ACA was immediate and predictable. Use fear to maintain the current system of corporate medicine and profits. Before the ACA, the U.S. was the only developed country where a pre-existing condition prevented millions of people from obtaining health insurance at any price. After all, health insurance companies are in business to make huge profits for management and investors, not lose money treating sick people. Health insurance companies had a long list of pre-existing conditions to deny insurance. Without health insurance, patients receive bills for the full amount. Americans with pre-existing conditions had 3 options: employer health insurance, Medicare if they're 65 or older, and Medicaid if they met income limits. Conservative politicians predicted gloom and doom if the ACA became law. Gloom and doom? The price of healthcare stocks have increased in the 9 years since the ACA became law. While the ACA restricted denying health insurance coverage due to pre-existing conditions, it does not protect Americans from exorbitant out-of-pocket costs compared to universal health care. For example, Grace lives in a country with universal health care. She's home recovering from emergency gallbladder surgery. Her out-of-pocket costs were zero. There are no copays, coinsurance, or deductibles for the hospital, surgeon, and anesthesiologist. Susan lives in the U.S. and had the same procedure. To lower her monthly premiums, she has a high-deductible plan and health savings account. Her in-network fees totaled $8,460. She must meet her $7,000 deductible before her plan pays for covered services. Her insurance pays $1,460, and Susan owes $7,000. Susan's HSA, checking, and saving accounts total $481.27. She has no idea where she'll get the money to pay her medical bills. Without health insurance, Susan would have owed $16,000 to $25,000 for the same operation. Like Medicare, the cost of universal health care is covered by a payroll or income tax. Unlike Medicare that covers Americans 65 and older unless permanently disabled, universal health care coverage begins at birth. Instead of a less stressful universal health care system, Americans have corporate wealth care. Universal health care is not perfect, but most people covered by it prefer it to the U.S.'s wealth care system. Please leave a comment if you have any questions about this video. Thank you for watching.